Alaikum. Hey guys, and welcome to today's tutorial. We're going to be talking about polyhydramnious and oligohydramnious. Okay, so let us start. We're going to define the amniotic fluid. We're going to talk about where it comes from, its production, some of its functions, and then we're going to dive into oligohydramnious and polyhydramnious. Alright, so for the definition, amniotic fluid is defined as the serous fluid in which the embryo is suspended. Amniotic fluid is produced almost exclusively from fetal urine from the second trimester onwards. However, during the first trimester and before the fetus forms its kidneys, the amniotic fluid comes from the maternal plasma. Okay, so this is the cycle of amniotic fluid. As you can see, it goes through a transmembranous pathway, and the urine comes out, gives us the amniotic fluid, and the baby swallows the amniotic fluid. Alright, so its functions are protection, temperature control, infection control, lung and digestive system development, muscle control, lubrication, umbilical cord support. Okay, we're getting into the oligohydramnious. Oligohydramnious means that the amniotic fluid is scarce. There's scarcity in amniotic fluid. It is defined as the amniotic fluid index of being less than the 5th centile for gestation, or it is less than 8 centimeters. Okay, what causes oligohydramnious? If the amniotic fluid is not getting produced, for example, because of renal agenesis, multicystic kidneys, and urinary tract abnormalities. These are all regarding the baby. Also, if there is FGR and placental insufficiency, this is for the mother, and some drugs, for example, non-steroidal anti-inflammatory drugs. Other causes include post-dates pregnancy and leakage of the amniotic fluid. Alright, so how do we investigate? We request an ultrasound, and the ultrasound gives us measurements of the amniotic fluid and its amount. Okay, so the complications are, some are related to cause. For example, if the cause is preterm rupture of membranes, then this is usually followed by delivery. If it is caused by IUGR, then we can expect that the baby is not going to be well, and it's going to have long-term morbidity. Okay, so this is one of the complications. This is called talipes club foot, and it is because the baby did not have sufficient room for his feet to develop properly. This is Potter syndrome, and it is also a complication of oligohydramnious, especially that caused by renal agenesis. Another picture of Potter syndrome. And that is all we have for oligohydramnious. Let us now talk about polyhydramnious. It is defined as the amniotic fluid index being more than 22 centimeters and the maximal vertical pocket being more than 8 centimeters. The total amniotic fluid volume being more than 2 liters. As you can see, this is an ultrasound measurement of the deepest vertical pool, the yellow line depicting the deepest vertical pool. It is caused by, and you might guess, yes, the exact opposite causes of oligohydramnious. There are causes related to increased fetal urine production, and these include maternal diabetes, twin-to-twin transfusion syndrome, and it can be seen in the recipient twin, and fetal hydrops or hydrops fetalis. The other reasons are the fetal inability to swallow and absorb amniotic fluid due to obstructions in the GI tract, or because of any neurological or muscular abnormalities, for example, myotonic dystrophy or anencephaly, or if there are any abnormalities, for example, in the face. And the most common cause of polyhydramnious is idiopathic polyhydramnious, and this is usually mild. Okay, so the presentation is abdominal pain and difficulty in breathing, and if the mother presents with this, then you have to reduce the amount of the amniotic fluid. The management usually is amniocentesis. Amniocentesis, and this is defined as drainage of excess fluid using a needle. Or you can use some drugs, for example, non-steroidal anti-inflammatory drugs, and the most common drug used in this is indomethacin. Indomethacin. All right, remember these names because we're going to ask you about them. The complications of polyhydramnious are preterm delivery, preterm rupture of membranes, and if there are, of course, complications of the cause. For example, if it's caused by ductal atresia, then you might expect that the patient has trisomy 21. Malpresentation at delivery because of increased room for the fetus to move around, and maternal discomfort due to abdominal distension, and it can cause some difficulties in breathing. Okay, so this is all for today's lecture, and I'm now going to ask you a couple of questions. As you can see, I have sent you some of the links, and I would like the participants to please go in and answer the questions. As you can see, there are 3 links, and they will send you to polls everywhere. After you have finished, please let me know. There are also some questions in the polls section in the chat room. If you open the polls section in the chat room, you will see that I have also added 3 questions. Whenever you are done, just let me know. Alright guys, thank you for your participation. Okay, for the first question, and it read polyhydramnious is not seen with, and yes, all of you have answered renal agenesis, which is the correct answer. The next question: during early pregnancy, amniotic fluid contributed by, and yes, again, all of you have answered maternal ultrafiltrate of plasma, which is again the correct answer. Hooray! And finally, for our final question, the drug of choice to reduce polyhydramnious is, and again, 100% of you, all of you answered indomethacin, which is the correct answer. Okay guys, thank you for your time and attention, and I hope that you benefited from this.